RBC abnormalities. Main one is anemia. It is a disease of deficiency in oxygen carrying capacity of blood. The inability of oxygen carrying capacity of blood. Anemia can be due to the quantitative deficiency of hemoglobin, or if the quantity is sufficient enough, the functional defect of hemoglobin. And although RBC and hematocrit shows decrease, anemia is defined by a decrease in hemoglobin concentration for an individual according to their gender and age. One of the response to hypoxia is an increase in secretion of erythropoietin by the kidney, accelerating the maturation and release of RBCs into the circulation. So, if your oxygen level decreases in a case of hypoxia, what happens? Your body increases the secretion of erythropoietin by the kidney, thereby stimulating the bone marrow for the acceleration of maturation of and release of RBC into the circulation. So, hypoxia is a triggering factor also for increasing the number of RBC production and release into the circulation. Circulatory system also responds to anemia, that is decrease in hemoglobin content, by increase in heart rate, increase in respiratory rate, and increasing your cardiac output to deliver more oxygen to the tissues. In a patient with anemia, the general symptoms will be fatigue and dyspnea. Other symptoms are depending upon the cause of your anemia. That is, according to severe anemic patients, their symptoms will be tachycardia, hypotension, and if untreated causes cardiac failure. The severity of symptoms depend on the degree of hemoglobin reduction, the state of the patient's cardiovascular system, and the rate of development of duration of your anemia. Anemia is classified by pathophysiology, whether that caused by decrease in RBC production or increase in RBC production or loss. Practical approach to classify anemia is your MCV, which is macrocystic, microcystic, or normocystic. That is your mean corpuscular volume, the size, the amount of cells. Most common type of anemia is a result of iron deficiency. This deficiency occurs due to dietary deficiency of iron, usually in poverty, increased need of iron that is not met during pregnancy, infancy, adolescence, or growth spur, malabsorption of iron, and chronic blood loss. So, blood loss വരുമ്പോഴും iron deficiencies കാണാനുള്ള സാധ്യതകളും ഉണ്ട്. Iron is required for hemoglobin synthesis, and with sustained low iron levels, the bone marrow begins to produce smaller RBCs, that is your microcystic cells, with a decreased amount of hemoglobin. So, the RBC indices becomes microcystic and hypochromic, that is smaller amounts of cells and with low concentration, hypochromic. So, these are the symptoms, signs and symptoms seen in anemic, acute anemic patients. Now, in chronic anemia, it can also be caused by chronic inflammations caused due to impairment of iron regulation and RBC production in the bone marrow. The result often is normocystic but can be microcystic in a long duration of disease. Macrocystic anemia is often caused by either folate or vitamin B12 deficiency. Low folate or vitamin B12 impairs DNA synthesis in the nucleus, ineffective blood cell production, and macrocystic RBCs. Hemolytic anemia consists of a large group of disorders where there is excessive destruction of RBC in the circulation exceeding the capacity of the bone marrow to replace the cells that are lost. This is usually caused due to intrinsic defects in the RBC like sickle cell anemia, extrinsic factor to the RBC, that is hemolysis caused by antibodies, malarias or drugs. And for all these kind of different types of anemias, treatment is oxidation, denaturation, other chemical reactions. Most common form of inactive hemoglobins are carboxyhemoglobin and methemoglobin. An overview for this is patients with anemia have decreased oxygen carrying capacity of the blood. The response to severe or chronic anemia is vasodilation, which increases the demand on the heart to maintain the blood pressure, resulting in high rate of cardiac failures. So this is about anemia.